Hi everybody. Today I'm answering the question, what are the different reasons consumers and caregivers use patient healthcare portals? And this is a follow-up to the other video that I have up saying, should people even use the portals? If you're a caregiver for an aging parent, you're probably that caregiver because mom or dad need a little help, or you're managing aspects of their health. So stay with me. I'm going to share 4 practical uses of patient healthcare portals for individuals and for caregivers. I'm Pamela D Wilson. My website is PamelaDWilson.com. On there, online courses for caregivers, ways to schedule personal consultations with me, my podcast, The Caring Generation, a library full of articles, my blog, a book, a lot of helpful information. So please press the share button on this video, share it with other people that you know who are looking for help, and support. Follow my channel. There are hundreds of videos here answering questions caregivers ask. So number 1. Annual checkups. Now, while many people, until they begin to start experiencing health problems, probably skip annual health checkups, these are more important than you might even imagine. First, if you have health insurance, check with your insurance about how often they pay for annual checkups so that you know. Because here's the thing, if you want to stay healthy, if you are watching your elderly parents suffer from a long list of health conditions and you don't want to be like them when you're older, then the way to avoid that and be proactive is annual healthcare checkups. Why? Because checkups give you an early opportunity to catch health issues before they become serious or permanent so that you could actually do something about that. How practical is that, right? So why don't more people do this? Well, it's because there is a significant lack of healthcare education here in the United States and really worldwide about how to stay healthy. Most people don't become involved with a doctor or a healthcare system or a hospital until there's a problem. But by then, that problem may really be a problem, and it may be serious, and it may be permanent, and you may not be able to go back and fix it. You may have to live with it. And that's what chronic disease means. So my advice is don't do that to yourself. Establish care with a doctor. Learn what your health insurance pays for and doesn't pay for, and establish annual health care or biannual health care visits. Get your blood work done. Stay healthy. Number 2 reason people use healthcare portals or become acquainted with them is an acute illness, an accident, or a hospitalization. If you're a caregiver for a parent, you've probably already experienced this for them. Becoming seriously ill, like many people did with COVID, they were hospitalized, or having an accident in the home or the yard, you fall off a ladder, or you cut yourself, or you do something when you're mowing the lawn, or a sporting accident, you bike, you ski, you boat, something else. Anything like that can take you to the hospital. Now, here's the bright spot. If you're already established with a primary care physician or healthcare system, the hospital can access your records. They know about your health. They know how often you go to the doctor. They know your prescriptions. They know a lot of other information. This is super helpful if you're in a lot of pain and you can't talk and you can't explain information to them. They can look it up. Super important if you have an elderly parent who gets confused or agitated, or if they have memory loss and they go to the hospital and they can't explain what's going on. Now, to be honest, when you go to the hospital emergency room, it's really important to report what's going on, your pain level, how you feel, because when you're in the hospital emergency room, it's something that happened fast, it's an emergency. They need to know what's wrong with you so they can treat you very quickly. Now, if it's not an emergency, don't go to the ER. Go to an urgent clinic, make an appointment with your doctor, do something else, because really, hospital emergency rooms are for health emergencies. Number 3 reason for using an online healthcare portal. So let's say that you were the person who didn't know the benefits of annual healthcare checkups. And all of a sudden you felt horrible, you went to the hospital emergency room, and now you have this chronic condition that is permanent. It's going to be with you for the rest of your life. High blood pressure, diabetes, COPD, some other health condition, right? And this is going to require that you go to the doctor on an ongoing basis. So now you have this one chronic condition, maybe more, but being in a healthcare portal, establishing care, can make it easier to manage your health. And here's the thing. So let's say you have high blood sugar and you went to the hospital emergency room, they run a bunch of tests, you go to your doctor, the doctor can look up those tests, they can run more tests, and then they can compare test A to test B to test C to see how your blood sugar levels are trending. Or if you have high cholesterol, they can track your high cholesterol, your triglycerides, all of those numbers. What's the benefit? Well, if you are making changes in your lifestyle, or if you're taking medications, and they run the tests and they compare them, they can see if what you're doing is making the condition better or if it's getting worse. And then they know how to treat you. And then you know what to do to maintain your health. So all of that information is helpful. Then let's go to number 4. You're a caregiver for an elderly parent who, if they're 80 or 90, they could have a lot of healthcare conditions. Heart disease, heart failure, maybe they had a heart attack, diabetes, arthritis, COPD, skin cancer, regular cancer, memory loss, Alzheimer's, dementia. Maybe they're seeing 4 or 5 doctors. If you're the caregiver, you know this. It is a lot to manage. Why have to contact this doctor and this doctor and this doctor if you can go online to a single healthcare system portal? And so a healthcare system, they are organizations like Kaiser, HCA, Common Spirit, Ascension Health, Trinity Health, if your parent was a member of the military there in the VA. So if you sign mom or dad up for these portals and these healthcare systems, you have access to all their doctors in one place. It's easier, it's less time consuming for you. And on the other hand, it's easier and better for the doctors who are managing your parents' care because they can see what Dr. A is doing and Dr. B is prescribing. It reduces the likelihood of your parent having to have the same tests run over and over again because it's all in the system. It reduces the likelihood of medication interactions because Dr. A knows what Dr. B is prescribing. It also allows you to be a better advocate because you have all this information at your fingertips to be able to help yourself or a parent or a grandparent or a spouse. So these are the 4 practical uses for patient healthcare portals that can really make your life easier if you want to stay healthy or if you're a caregiver for a loved one. I'm Pamela D Wilson. My website is PamelaDWilson.com. On there are a lot of hope, help, support for caregivers, people who want to stay healthy, aging adults. Press the share button on this video. Press the follow button to be advised of new videos that I release every week or 2. Thanks for being here with me. Have a fabulous day today. I'll see you all again soon in another video.